Normal muscle cells in the uterus can begin to grow abnormally, creating non-cancerous tumors called fibroids. The problem is common enough that many women will have fibroids at some point in life, although most are too small to cause problems. But as Lurene Cachola reports, that may not always be the case.
It's a problem that can affect as many as 20% of all women during their lives. Fibroids are growths on the muscle layers of a woman's uterus and can vary in size from small as a pea or bean to the size of a melon.
So they can be on the inside kind of lining of the uterus, they can be in the muscle itself, or they can be more on the outside, even on a stalk kind of hanging outside of the uterus.
For LaMonica Clark, her problem began as anemia. It took several exams and tests to figure out what the problem was.
So after that, they sent me to have ultrasound. And come to find out, I had some fibroid cysts.
The non-cancerous tumors can be more common in women between 30 and 50, women who are overweight, and African American women. In Clark's case, tests showed that her initial problem was something that is a symptom of fibroids.
So he indicated that the fibroid cyst is actually what was causing me to be anemic.
Clark and her doctor chose a total hysterectomy, the complete removal of her uterus, to deal with the problem. Dr. Azari, with BMG Surgical Oncology, went with a minimally invasive approach to reduce her pain and recovery.
In some patients, barely you can see any scar tissue after recuperation from the surgery. So as we accept the concept of the surgery as a trauma to the patient, as a therapeutic purposes, we would like to have this trauma as minimal amount of possible, and the surgical aspect, minimal invasive surgery, has provided that compared to the traditional open surgery.
Doctors don't know what causes fibroids, although hormones may have something to do with it. Fibroids are more common when women are in their reproductive years, and they can swell when levels of estrogen are high, such as during pregnancy.
We believe that it is related to estrogen because as women go through menopause, that's when we really see these tumors shrink and stop causing any problems.
Dr. Bishop of the Ruck Clinic says while many women with fibroids don't notice any symptoms, there are things that can indicate fibroids are present. Symptoms can include longer than usual periods, heavy bleeding, bloating, fullness or pain in the pelvis, constipation, or pain during sex.
The big fork in the road is whether patients still want to have pregnancies or not. Certainly if there's multiple fibroids and they're done having children, then many times a hysterectomy is what we are looking at. However, if they're still in their childbearing years, we can, or don't want to have surgery, we can control them many times by placing them on birth control pills or use an intrauterine device called the Mirena, which can slow the bleeding down.
Most women with fibroids usually don't have problems getting pregnant, but for women who already are, fibroids can enlarge rapidly and cause pain. But fibroids aren't removed during pregnancy. They're usually treated with bed rest and ice. For Smart Medicine, I'm Lurene Cachola.